I've been having a lot of trouble with my child, and I'm wondering what kind of things cranial sacral can help, and what kind of kid can use cranial sacral, what it can work with.
You know, I see children for a wide variety of reasons. The most obvious would be if a child has experienced a fall, a head trauma, a surgery, dental work. These are all things that are very traumatic for children. And the child will be affected by these traumas in ways that you wouldn't really think to look for. They may lose some of their creativity. They may start to actually have trouble learning. There's parts of them that start to shut down. They may talk less. They may forget the stuff they just learned about the alphabet or some other numbers, or many things that children we just take for granted. You know, they're just constantly, their brains are growing and they're growing into themselves, and that process goes into a freeze, and they really stop development, and they'll shy away from maybe social situations, or maybe they'll become more clingy. Children are also traumatized by seeing someone very ill. For instance, I had a child come and he was in the car with his grandmother, and his grandmother actually was having a heart attack but couldn't speak. And he went to try to get help, but he didn't speak well enough to actually get help. And so nobody came. And so here he was in the car, stuck with his grandmother. So nothing happened to him. And his grandmother did die, a few weeks later, and he missed her. So here you have the death of a grandmother, a loved one, but you also have this child feeling like they want help, they can't get help. And this can come out in all sorts of ways in their behavior. I mean, even as negative behavior, which is the first thing we think of. You know, my child is not behaving properly. It can also turn into, people talk a lot about ADD, and really all ADD is the inability to stay on track. It's the inability to take your environment in fully. So some part of you is not available, and often it is triggered by a trauma. And so this work can very much help by resolving these traumas physically and emotionally, so that the child can thaw out those parts of themselves that have become frozen.
Now, what would a session look like with a child? Do they lay on the table, or do you play with them? Or?
It's kind of up to the kid. I get along well with kids. I'm happy to get down on the floor. I have toys in my office. Sometimes we'll play. We'll play maybe even with pillows and tunnels and balls, moving around. Sometimes the child will want to lay on the table, kind of depending on the age. When they're very little, they want to move. And it's through their movement and the play that they make up that they actually show me where this information is cycling in them. And to their parents, it's not obvious. They're not looking for that. But to me, it becomes very obvious.